Hi, my name's Dr. Lloyd Marks. I'm a consultant regarding medical technology commercialization. I have a background which is well suited to this purpose, and I'd like to tell you a little bit about me in this video. I received a degree in electrical engineering from MIT and decided to use my electrical engineering knowledge to solve medical problems. To that end, I went to the University of Michigan Medical School initially without the intention of ever practicing medicine. However, I discovered that I enjoyed taking care of patients and went on to do an internship in pediatrics at the University of California, San Diego. After a brief stint working at the Laboratory for Technical Development at the National Institutes of Health, I completed my pediatrics residency at the Children's Hospital National Medical Center in Washington, D.C. Because of my interest in medical technology, I pursued a fellowship in pediatric cardiology at the Johns Hopkins University. While there, I participated in the first interventional procedures ever performed in children, which were used to open blocked valves and blood vessels without requiring surgery. I brought this knowledge with me to my first faculty position at the State University of New York in Stony Brook, where I performed the first pediatric interventional procedures in the New York metropolitan area. 3 years later, in 1986, I was recruited to become the director of the cardiovascular laboratory at St. Christopher's Hospital for Children, where I specialized in interventional pediatric cardiology. In 1994, I was recruited to become the chief of the Division of Pediatric Cardiology at the Children's Hospital of New Jersey, where I had a staff of about 5 doctors and 20 support staff. In 1997, I went into private practice, which I maintained until 2015. I always maintained dual academic appointments. When I was at Stony Brook, I had an appointment in the electrical engineering department, while at St. Christopher's Hospital for Children, the Department of Biomedical Engineering at Drexel University, and while in the Children's Hospital of New Jersey at New Jersey Institute of Technology. During that time and afterwards, I developed numerous medical devices and currently hold 22 patents on them. I've learned quite a bit about intellectual property, including writing invention disclosures, writing patent detailed descriptions, and working closely with patent attorneys to develop patent claims. I'd like to mention 2 of my favorite inventions in this video. While a medical student, I observed a patient bleed to death overnight from an undetected occult bleed after an elective vascular procedure. This occurred because the body constricts blood vessels to non-vital organs, such as the muscle, to keep the blood pressure normal. This is done to maintain blood flow to the heart and the brain. By the time the blood pressure falls, however, it can often be too late to save the patient. As an engineer, I was determined to come up with a way to detect this condition early. When I was at the National Institutes of Health, I explored the use of a laser Doppler technique to detect the decrease in blood flow to the limbs, but unfortunately, this was unreliable. When I was a fellow at Johns Hopkins, I developed a device which I called the pulse flow meter, which detects limb flow non-invasively and continuously. This worked out quite well, making it possible to detect the loss of a single unit of blood in blood donors. I founded a startup, MGI Medical, to commercialize this technology, and we're going to start clinical trials in the near future. Hopefully, this will be used routinely in post-op patients, GI bleeders, and trauma victims. And the second invention I'd like to mention is a device for closing abnormal holes in the heart called atrial septal defects. These are holes between the 2 upper chambers of the heart that should not be there after birth. This device uses a wire made of a special alloy called nitinol, which has shape memory properties. It is introduced through a catheter in the leg and then expands to form 2 discs, which close the abnormal defect when exposed to body temperature, thus making open heart surgery unnecessary. After I retired from clinical medicine in 2015, I attended business school at the University of Tennessee Haslam School of Business in a program designed for physicians. While there, I developed an interest in finance and wrote a business plan for MGI Medical. I also attended business school to position myself to become a consultant for medical technology commercialization. I've provided advice to universities regarding the efficacy and commercial potential of medical inventions developed at their institutions, and to corporations for optimizing their user interface for medical devices and for helping them to decide whether to acquire other smaller medical device companies. I consider my strengths to include evaluation of the efficacy and commercial potential of medical technology, evaluation of intellectual property, optimizing the form factor and improving inventions, conducting clinical trials, helping to start new medical device businesses, negotiating invention licenses, and writing and editing business plans. I would be happy to discuss my background and skill at greater length in a personal conversation. Thanks for listening.